1.5 hours about psychiatric stuff and the like. So we don't need much time for doing that. We only need the willingness and the openness to do it. So what we should try to do is convince the government and those who are responsible for formation and education to integrate the knowledge you have into the formation of professionals in the entire healthcare, but probably also for teachers and for lawyers and for churches and the like. So the duty or the task is not that heavy as it seems. The problem for professionals is when they do not have an understanding of the problems, they do not ask you about your experience because they feel no longer on safe ground when they raise those kind of questions. Where is it? Huh? Yeah, it's not here. Where is it? Here it is, thank you. It was John Bowlby who said, human psyche, like human bones, is strongly inclined towards self-healing. The physician or the psychotherapist's job is like that of the orthopedic surgeon, is to provide the condition in which self-healing can best take place. It's not such a hard task as you may believe. Now, what should we integrate into the curriculum? In the meantime, we have a bunch of knowledge about trauma and the effects on health. There's clear evidence. We need that for therapeutic approaches, and we use it for therapeutic approaches. We don't have to reinvent the wheel. It's done within the last 40 years. Now, what do we have to teach to professionals? Sexual violence in general, incidents and victim reaction and the like, the gender differences when it comes to male or female victimization, a little bit about offender strategies. It's very important that professionals working in that area know how they groom their victims. And what's that? What's the meaning of that? To understand victim reaction better. It's not a forensic training you get when you do that, but you have heard that from Jim Clemente, how important it is to understand grooming. So we need to know a little bit more about that as healthcare professionals. Psychotraumatology is no question. I come back to that in a minute. Epigenetics, again, I will talk about that. Attachment theory as one of the probably most important conditions for our well-being. And finally, interpersonal neurobiology, in order to better understand the psychological, but also the body reactions we have after a trauma, such as sexual violence. What is that? Ah, here it comes, sorry. Affective neuroscience is studying the effects of violence on psyche and body. And what you also can see from here, from that picture, is it's a kind of an universal reaction. It not only affects human beings, but also animals. When you not have a safe attachment, that undermines your ability to have a safe life. Let me jump to the ACA study, a bunch of evidence we have from that study, which was done in the United States. examining the impact of negative life events on health condition. And what they did was, this is a healthcare program in San Diego, including 70,000 subjects. They scored. When you have experienced sexual violence, you get 1 point. When you have experienced physical violence, you get another point. When you have experienced neglect, you get another point. When you had a father who was violent towards your mother, you get another point. 10 altogether, not more. So very simple. No question was how long it was and how severe it was, and the like, only whether you get it or not. And the results are overwhelming. What you see here, score 1, 2, 3, 4 and more, and the number of affected subjects. And what you now see through all these pictures I will show you now is always the same. 1, 2, 3, 4, 5, 6, and the more. Now the first is on, I can read it. What's that? Smoking or what? I have it here. Wait a moment. Eh? Depression, thank you. So, the more violence, or the higher the score, the more depression. What's that? Suicide. When you have a score of 4, the probability is 20% that someone has committed at least one attempt of suiciding. Again, the more violence, the more. It's not explaining why. It's only saying the more violence someone has experienced, the greater is the likelihood that someone has that and that. I think that's the number of unexplained symptoms. It's very important for physicians that they understand what they address as functional disease, where you don't have a disease of the proper organ but similar symptoms. Physicians must learn to ask patients about their past experiences. What is that? Huh? Yeah, abused what? I can't read it, sorry for that. Okay, thank you. Again, the more, the more. People are suffering from unexplained symptoms, means the body balance is involved. The vegetative nervous system is reacting. Many have pain, where there is no reason, obvious reason for that. Many have problems with stomach and the like, with the urogenital system. Many have headaches and the like, with any obvious reason. Is that smoking, or what is that? Alcohol. The more, the more. We have learned that alcohol is part of coping strategies. Alcohol is very effective when it comes to reducing anxiety and pain, but it's not a good thing to do it because it makes you become addictive. What's that? Smoking, same. Why do people who have affected trauma do smoke more than others? Teen pregnancy, teen getting children. Why do teens having more problems related to sexual stuff when they have been affected by violence? What is that? Liver. Sorry, I can't see it myself, so that's why I have to ask you. Lung problems, heart problems, all is related to the more violence, the more. And this one I jumped. That's the age distribution in the various groups. Now let me proceed to epigenetics. Maybe epigenetics gives us an answer to better understand the impact. Epigenetics is how our body regulates the DNA and to transfer it, that information, into whatever it is. So we have eyes, we have ears, we have hair, we have all that, all based on the same DNA. It's everywhere the same. And the epigenetic regulation makes it as we are. That helps us to become what we are. It's not as complicated as it may look here. The epigenetic regulation is done by methylation. Methylane groups are added to the DNA, and when they are added, the transcription does no longer work. That's how it is operated. Now, it was Michael Meany from Montreal, who investigated, I think 25 years ago he started to do that project, the impact of trauma on epigenetic regulation. And what he found out was, in normal subjects, in normal growing up, there are many binding sites which are blocked by methyl groups responsible for stress regulating. That reduces the stress regulating systems after a couple of months after birth. Whereas in those persons who have experienced negative effects during their childhood, this doesn't take place, with the result that you have an overwhelming stress reaction. You have too much binding sites for the stress regulating system. Now when it comes to a signal from here saying that's a dangerous situation, you have an overwhelming reaction, both psychological but also in your body. There's a bunch of literature available. You see one or the other reference or literature on that. Look here at the last one. It's saying child abuse and epigenetic mechanism of disease risk. How is health condition influenced by what you have experienced? Now, attachment, having a loving relationship, is a good thing. It's a healthy thing. It helps us keep in balance. But when it comes to sexual violence, that's no longer that picture. So, especially when the violence is committed by professionals in their work. This picture shows you two faces of the same reality. In most of the time, only the victims see the dark sides of the offenders, because we are not affected by that. We believe it's a well-respected professional, it's a good teacher, it's a good healthcare professional, whatever. It's a good mother, a good father, whatever. Good grandfather, good uncle. The victim sees a reality which we do not see. And it's often difficult for victims to share what they have experienced. That's part of the offender strategy, when they start saying, well, she was telling those stories since many years. She's lying, and the like. Offenders have a strategy, how they proceed and how they groom and finally sexually abuse their victims. And it all starts within their head, with fantasies. Some of them have the attitude that it's okay to have sex with a child. Nothing blocks them. And then they target the victim, they groom it, and grooming means manipulating the victim. giving gifts and the like. In brackets, giving gifts can be a very good thing. But when offenders use the same strategy, they groom it. They groom their victims to prepare them for the sexual assault. And then it takes place, and afterwards is silence. Often the victims are silenced by the offenders, by threats. And it can go on and on. When it comes to institutional abuse, it takes place within a context of an institution. We have heard about that Sandusky case from Jim Clemente was talking about that from Philadelphia. That football coach used the reputation of the institution, Jimmy Savile in UK. He was voluntarily working in hospitals. Hospitals are usually considered as safe places, but we have learned from survivors, no. They should be considered as risky places. And nobody ever could imagine what Jimmy Savile was doing there. And no one believed those victims. And we have seen that movie, Spotlight, talking about Catholic Church in the United States, what they did from an institutional perspective. It's completely unacceptable. And often the institutional reaction contributes to the sexual violence. It facilitates it, it makes it happen on and on. Now when we talk about the trauma and the effect it has on the health condition of affected persons, I present you here a very dangerous snake. What would you do if I have one here? Leaving the room, going out. Why? Why do you know that's dangerous? We have learned it. And now think a moment about what do victims of sexual abuse experience and what do they learn? They learn a lesson, a lifelong lesson. Nobody will take care for them. Nobody is interested in their story. Nobody will listen to them and the like. That's why I'm showing that snake. We learn it. We learn those reactions. And in 2002, the WHO in Geneva for the first time published a report on health and violence and the relation between them. Now, if anybody of you knows the headquarters in Geneva, that's a huge building. And there's one office, I think in the 5th or in the 7th floor, one office, 2 persons are working there. They are those who are responsible for violence and healthcare. So you can see it's not that much importance in the WHO, but at least is an office there dealing with those issues. And it was Henry Ellenberger, a Swiss guy who worked in Canada, to put together the history about how we as a profession learned to understand trauma reaction. It's a long history. It's an interesting book he wrote. And it all started with the Egyptian folks. They had an understanding of mind, which is important for understanding the reactions victims show. And today, neuroscience explains us how alarm reactions are handled within our system. We have these bottom-up reactions, and we have the top-down reactions from our brain, from the knowledge and the understanding. The two together make what is an alarm reaction. And it was in 1980 when psychiatry for the first time created a diagnostic entity called PTSD, and at the same time They had invented a diagnosis. At the time they addressed it as multiple personality disorder. In the meantime, it's renamed as dissociative identity disorder. Both are related to trauma. PTSD, at the time in 1980, was considered as a reaction on a trauma outside of normal human experience. It was mainly related to war and torture and the like, and a little bit also to sexual violence. But over the years, this definition changed considerably, and today sexual violence is considered as one of the major avenues to get a PTSD or other trauma-related disorder. And in the meantime, and by the way, I'm here as a psychiatrist. Let me explain just in a few words what is a PTSD to make it clear. If someone experiences a trauma and then showing reactions, and the reactions are more like clusters. The main thing is nightmares and intrusions and flashbacks, creating anxiety problems. The other thing is an avoidance behavior, meaning affected persons do not watch TV because that triggers their memory. You have a hyperarousal, that means you get anxious by little stuff, and you have numbing, that means you're somehow covered with all those issues, having the feeling of it will never go any better and the like. If those symptoms are present for more than a month and create a significant impairment in your well-being, in your ability to work and the like, then we address this as a PTSD. Now, when we talk about sexual violence, it's rarely one event, and it's rarely, I say in quote, simply the sexual violence. In most time it's embedded within other forms of violence, like physical violence, emotional violence, neglect and the like, creating a much more complex picture. And I'm glad to announce to you that in the new ICD-11 version, which will be published next year, we will have a diagnostic entity called complex trauma. That's much more adequate to what we see here, because it is an ongoing trauma. And imagine you have a wound here and you rewound it, it's going worse. And if you rewound it once again, it's going even worse. So that's the idea behind the complex trauma issue. And the complex trauma will not only cover the psychological reactions, but also the body reactions, which seem to have been forgotten by psychiatrists, that we also have a body. Another way to talk about that is we consider today the problem as a trauma spectrum disorder. And the trauma spectrum disorder means we have a variety of possible diagnoses when it comes to trauma. On top, the stress reaction, and in the bottom, dissociative identity disorder as probably the worst possible outcome. Psychiatrists should listen to survivors, and you should be given the opportunity to help them while they are in formation. You learn it, that you are the experts, and we should use this expertise for the training and formation of professionals. The knowledge is around. We have to teach them about those issues to enable them to better understand victims' reactions and to make the healthcare system to become a safe place. That's it. Thank you for listening.